Hello, I'm Baron Jam, and I'm here to help you answer the question to cast or not to cast. The research may surprise you, so hold on to your seats. Allow me to begin with stating that fracture healing is a complex physiological process. Therefore, I'm in no way providing any specific medical advice. Always consult and follow the recommendations of a trusted physician and an orthopedic specialist at a fracture clinic. At the risk of being judged as a quack, please appreciate that in the next few minutes, I'm only quoting studies published in peer-reviewed journals on the topic of fracture healing. What if the current medical system is too quick to put on a cast and recommend 6 weeks of immobilization and complete rest for certain stable fractures? What if a less conservative approach was taken and people were told to weight bear or move as tolerated? Would that approach result in an increase in the risk of delayed non-union fractures? Or could an approach that involved less than the traditional 6-week immobilization and absolute restriction on weight bearing and movement actually result in better outcomes? The fact is that millions of fractures occur each year. The positive news is that over 90% of them heal well, despite it being a traumatic and painful event. However, due to various factors, 5 to 10% of fractures don't heal in a timely manner and may even require open reduction internal fixation, or RIF. Casting and splinting date back as far as 5,000 years when the ancient Egyptians used wooden splints. Fast forward a few thousand years, the practice has continued in modern medicine. After 5,000 years, one would think ample evidence such as randomized controlled trials would exist supporting the benefits of casting or immobilization and unloading for various fractures. So I decided to look up on PubMed, randomized controlled trials, fractures, cast, immobilization, healing, all those words. To my extreme surprise, I was shocked at how little I found. It is as if the medical community assumes that stabilizing and fully unloading for 6 weeks with a rigid cast to be a unquestionable entity, a gold standard of some sort, that shouldn't even be questioned. I realize that to date, there are no randomized placebo-controlled studies to support the benefits of using a parachute when jumping out of a plane. You get my point in this. This study was even published in the British Medical Journal a few years ago. Yet, just because the use of parachutes has never been compared to a control or a placebo group does not mean that parachutes are ineffective. I get that. Even though management strategies for most fractures haven't yet been researched in randomized clinical trials, it can be appreciated that immobilization and/or open reduction internal fixation may certainly be the best options in many cases. However, is it possible that sometimes immobilization and non-loading of some fractures may not be the optimal management strategy? Before I share with you the 15 studies on fracture healing that may surprise you, I wish to quickly review the 15 potential risk factors for delayed fracture healing, such as age. Basically, children heal faster and seniors heal slower. Uncontrolled diabetes, chronic iron deficiency or anemia, vitamin B6 deficiency, reduced intake of vitamin C and protein, hypothyroidism, peripheral vascular disease can delay fracture healing. The use of certain NSAIDs, although the studies are conflicting as some say yes, some say no. Long-term steroid therapy. Statins, again the studies are conflicting, some say yes, some say no. Smoking. Alcoholism is a risk factor for delayed fracture healing. And we're not talking about the alcohol drink, the odd here and there. We're talking about true alcoholism. Antibiotics. Again, some antibiotics may, some antibiotics may not. The studies are conflicting. A gap of more than 2 millimeters in between the fractures. And excess motion and instability at the fracture site may delay fracture healing. To cast or not to cast? I look forward to seeing you at the next lesson, where we'll review the 15 research studies that may surprise you.